Hello and welcome to this WPS video titled Advanced Care Planning, Document Time to Avoid Errors. My name is Mary Mucko and I work on the Provider Outreach and Education, or PO team, at WPS Government Health Administrators. I'm pleased to share an important message for those providers that bill for Advanced Care Planning, or ACP. Voluntary ACP is a face-to-face service between a Medicare physician or other qualified healthcare professional and a patient to discuss the patient's healthcare wishes if the patient becomes unable to make decisions about their care. As part of this discussion, you may talk about advanced directives, ADs, with or without completing legal forms. An AD appoints an agent and/or records the person's wishes about their medical treatment based on their values and preferences. You can generally find ADs on your State Attorney General's office website. Examples of ADs include live wills, instruction directives, healthcare proxy, and healthcare power of attorney. Medicare pays for advanced care planning as either an optional element of a patient's Medicare wellness visit or as a separate Medicare Part B service. CMS has published a Medicare Learning Network, or MLN, fact sheet that provides information such as billing and payment, diagnosis reporting, coding, billing, and resources. You can find the URL for this fact sheet in the description of this YouTube video. There are two codes for the optional ACP services. One is 99497, which is Advanced Care Planning, including the explanation and discussion of advanced directives, such as standard forms, with completion of such forms when performed by the physician or other qualified health professional. First 30 minutes, face-to-face with the patient, family member or members, and/or surrogate. And an add-on code, 99498, each additional 30 minutes. This is listed separately in addition to the code for the primary procedure. When ACP services are provided as part of the annual wellness visit, or AWV, practitioners would report CPT code 99497 and add-on code CPT 99498 when applicable for the ACP services in addition to either of the AWV codes, G0438 or G0439. This slide shows the CPT code descriptions for 99497 and 99498 as they appear in the Medicare Learning Network MLN fact sheet. The deductible and coinsurance for ACP will only be waived when billed with modifier 33 on the same day and on the same claim as an AWV, and must also be furnished by the same provider. Waiver of the deductible and coinsurance for ACP is limited to once per year. Payment for an AWV is limited to once per year. If the AWV billed with ACP is denied for exceeding the once per year limit, the deductible and coinsurance will be applied to the advanced care planning. The purpose of this video is to alert you to recent comprehensive error rate testing, or CERT, contractor findings for ACP. Errors occur when there is no documentation to show the service is a face-to-face service between a physician or non-physician to discuss advanced directives with or without completing relevant legal forms. If your practice bills for this service, be sure the documentation includes this. For more Medicare resources for billing ACP, please refer to the links on page 5 of the MLN fact sheet. This will avoid errors and assure proper payment. I'd like to share with you an actual CERT claim review finding to help you understand why the CERT contractor assessed an error on a WPS claim. WPS paid a provider for CPT code 99497, first 30 minutes, ACP. The CERT contractor selected the claim for review and asked the provider for records. Documentation received included the authenticated visit note that supports the service was performed, but the note does not include documentation of time. There were other records received. These include the physician orders of life-sustaining treatment completed form, health risk assessment, patient health questionnaire, 9, a preventive screening schedule and lab report, all of the same date of service as the ACP. The provider also sent a signature log. The medical review result is an overpayment due to insufficient documentation. Documentation must include the face-to-face time spent for advanced care planning, including the explanation and discussion of advanced directives, such as standard forms, with completion of such forms when performed. If you are a WPS provider who bills advanced care planning, don't leave money on the table. For the example I shared, we know the service was performed. We know the service was documented. However, because the time was not included in the documentation, no Medicare payment can be made. Make certain providers in your office know the importance of including the time in their ACP documentation. I hope you enjoyed this brief video. If so, please like and share it, and consider subscribing to the WPS GHA YouTube channel. Thanks for tuning in. Have a wonderful day.